We are being joined now by White House Vaccinations Coordinator, Dr. Bechara Choucair. Thank you for joining us, Doctor.
Thank you so much for having me.
Well, we have just a few questions. For starters, is the White House concerned about Las Vegas City and the Clark County around it in particular? And if so, why?
Well, we are concerned about the rapid rise in the Delta variant across the country, particularly in places where there's low vaccination rate. What we know about the Delta variant is that it's much more contagious, twice as contagious, and those who are unvaccinated remain at risk. So when you have communities with low vaccination rates, you have rapid rise of a Delta variant, you have a recipe for a spike. And that's the concern that we're seeing in many pockets across the country at this point.
What exactly is the federal government doing, if anything, here in Las Vegas to try to get more people vaccinated? Can you speak to that?
Well, first of all, we have our COVID surge response teams that are working with Nevada, try to figure out what can we do to support Nevada in its response to the spike, whether it's with testing, with therapeutics, with supporting vaccination efforts, or even with any type of personnel that's needed through FEMA or technical assistance from the CDC. And our search teams have been working on the ground very closely with the Nevada leadership on that. We also know that we need to continue to support people getting vaccinated. That's why we're making sure that there are pop-up clinics at schools, at community colleges. We're engaging faith-based communities, community-based organizations to make the vaccine as accessible and as convenient for people to get vaccinated. And yesterday, the president called on the expansion of the tax credits for medium and small businesses to provide paid time off for people and employees to be able to take their family members to get vaccinated. He called on school districts across the country to offer on-site vaccination clinics. So we're doing a lot of work, and actually it is paying off. We're already seeing the percentage of people getting their first dose went up by 30% just in the last week alone across the country. So we know people are concerned about the Delta variant, and we're happy to see more and more people getting vaccinated across the country.
That's encouraging. We've heard the explanation from the CDC and other agencies, but we'd like to hear from your office. Why do fully vaccinated people need to wear masks now?
Well, the CDC guidance was very clear on this front. Let me start. The number one most important recommendation from the CDC guidance is if you're unvaccinated, it is really important to get vaccinated. Now, if you're fully vaccinated and if you're in communities that have a substantial or high level of spread, it is important that you wear a mask to protect yourselves. The Delta variant is a new variant. It's much more contagious. It's twice as contagious. And what we're realizing that when in the rare instances, when someone who's fully vaccinated is getting the infection, the level of virus in that person is pretty high, and that's the concern. But I do want to be very clear, though, that we know that the vaccines are very effective at preventing infections, and they're particularly effective at preventing severe consequences of the disease, like hospitalizations and deaths. So while we want to make sure that people are masking for their own safety, we also want to make sure that people who haven't gotten vaccinated yet are getting vaccinated. And for people who've gotten just one dose of the Pfizer and Moderna, now is the time that they get the second dose for full protection.
Okay. If or when vaccines are approved for children under 12, is the White House prepared to mount a campaign to get that done?
Well, we are preparing for all kind of case scenarios, a wide range of case scenarios, including making sure that we are ready for vaccines for kids when the FDA or if the FDA approves it. We're also working on a back to school effort that's coming up very soon, because we know we want to get as many 12 to 17-year-old vaccinated as possible. And we know that we have to be engaging with school districts, with local health department, community-based organizations, pediatricians, family physicians, and we're rolling up our sleeves and making sure that kids who qualify today, who are eligible today, are getting vaccinated.
What would you say to parents who are hesitant to get their children vaccinated?
Look, the science is so clear. The CDC scientists are very clear. The American Academy of Pediatricians is very clear. The American Academy of Family Physicians is very clear. We know that vaccines work. They protect adolescents and adults from getting the virus. They're particularly protective against severe disease, including hospitalizations and deaths. We know these vaccines work. Let's make sure that we protect our adolescents and protect our families and protect our communities.
Students here in the public school system are heading back to school in about a week. How important is it that students and staff wear their masks?
It is very important. I think the CDC guidance was very clear on that front there. Students, teachers, when you're indoor, to wear your masks. Equally as important is we want to make sure that we do everything we can to get adolescents and teachers and students and staff in schools vaccinated as well. And that's why the president is calling on all school districts to partner with either pharmacies or their local health departments or pediatricians in their communities to offer on-site vaccination clinics.
And last question, doctor, what is your guidance on perhaps getting booster shots?
Well, the CDC recommendation right now is also very clear. If you're fully vaccinated, you don't need a booster shot. That doesn't mean that might not change down the line. We don't know the answer to this. The CDC, the FDA will continue to track data to see what we're learning from the science, what we're learning from on the ground experience, and they will adjust their recommendation as needed. At this point, if you're fully vaccinated, you do not need a booster shot.
Dr. Bechara Choucair, thank you so much for your answers today and have a good weekend.
Thank you so much for